Good afternoon, everyone. Welcome to our live session this afternoon. We'll just wait for a couple of more minutes. We have 1 minute to go to 12 noon, and then we are going to start. Hey, Anshika. Hi, everyone. Hi, as you all would know, our topic for today is coming into balance, the importance of posture and movement. We are just going to wait for a couple of more minutes, let everybody join in, and then we are going to start. Hi, Vrishti. Hi, Nikita. Good afternoon, everyone. Hi, Lakshmi. I'm just waiting for Divya to join, and then we are going to start. Hi, Divya.
Hi, Tanvi. How are you?
Good, thank you. How are you?
Very well.
Great. So, welcome everyone for our Talking Tuesday Insta Live. As you all would know, our topic for today is coming into balance, the importance of posture and movement. Um, we have actually received a very, very good response for our this particular topic. We are going to talk about a couple of things, but you're more than welcome to just keep sending in your questions. We are going to address it as and when we can. Over to you, Divya.
Hi, welcome. So this is a topic that's very close to my heart as a doula because when I started working and I got the bookish knowledge of labor, there was a time frame to how babies were born. And then somebody said I had a long labor, I had a short labor, and it seemed like these babies were supposed to be on a timetable. And that didn't seem okay because such a large variety. And then and different women showed different labor patterns. And while the doctors only said, or she's not progressing, what those patterns, that got me going. And I started to think and study and learn. And I had wonderful teachers. But what I did, a transition, if you please. Transitions, if you are taking a So some of us plan for that meticulously right from the beginning, going all the way down, packing in time, making our lists. Some of us put together things last minute and rush off to the airport. So everybody does their preparation for a transition in their own way. And here is the baby. making a transition from the womb to the world in his own way. So, you know, one of the common things that come up when people go to doctors, they say, oh, my baby's head is still high. Is this baby a lastminute.com? So we figured out that babies have their own timetable and their own choices and their own priorities. But since there is a default setting in nature, some things happen in their own time, which is the baby's own time, towards the end of pregnancy, which means the head comes down. That brought us to our second question, that if this is a default setting and programmed in the baby, then why do some babies not turn down? So we started to talk about balance. Let's think of it like if you've been to a theme park and there is this big tunnel in which you twist and turn and you come out at the end. The mother's pelvis is like that joyride, if I may, for the baby, which means her hard tissues and her soft tissues are like guide rails to say, now take a left turn, now turn your head, now tuck your head in, now extend your head out, now push with your feet. And those things that the baby is doing is already pre-programmed. So when two pre-programs come in synchrony, that's a simple, straightforward physiological birth. But when was the last time you saw symmetry and synchrony in nature? The nature is amazing that way because it allows us so many possibilities and then yet come together in so many different ways. So infinite possibilities. Therefore, we start to talk about how to tune into this by looking at your own balance. Simple things you can do in pregnancy, towards the end of your pregnancy. How do you walk? Is your left and right balanced? Are there any, pains, nips, ticks, something that you find more difficult on one side than the other? And then begin to explore, how does my pelvis come into balance? Because if the pelvis is nice and balanced, then the baby's guidelines are already set into the anatomy of the mother's body, whether it's the hard tissues, whether it's the soft tissues. So there's a lot going on in this area. There's the uterus going down, there's a bladder, there's the rectum going down. There are other organs all around the baby. So it's kind of that the baby's path is demarcated by these little things if she's in balance. Now, if say this is the balance and it becomes like this, some space is taken away from here, some space is askewed on this side, but there are other organs that are trying to fit in. And that might cause the baby to have resistance to go down. So when the mother finds her balance, which movement, mostly, things will come back into alignment and the baby will get that passage. And that is what we're talking about. So this isn't about do this. It was heartbreaking for me because I had a mom I was supporting and she said, if I do 100 duck walks, will my baby come out? It was, and I looked at her and I said, do you want to do 100 duck walks? She said, no. But some expert told her that if she did duck walks, the baby would come out. I said, what do you want to do? She said, frankly, I just want to lie down on my back because I'm tired, on my side. So she took her left side and then she said, can you lift my leg up? So I sat by her feet and her leg was on my shoulder. And 30 minutes later, the baby was coming. So there is something that is going on in the baby and the mother that we are not listening because we have so much instructions coming from outside. And we're also being told, what do we know? We are not experts. So Tanvi, I'm happy to jump in with the questions if you have them.
Sure.
Just give a context of what the idea is.
So some of the questions which came to us were, well, why do some babies' head don't engage?
Well, I think I just answered that.
Yes. So
maybe, but there are two parts to it. It's not always a problem. Some babies like to come down lower because they are a little bit lastminute.com. Some babies try and settle in early because that's how we are. Some of us like to be well organized, tick off everything, be there in time, maybe even before time, well organized. And some of us want to do it on the fly. That could be one of the reasons. But the other reason could be that the pelvis is out of balance. So any kind of body work, exercise, release will help the baby come down.
Sure. Uh, the second question, which was there was, how does the position of the baby matter?
Yes, if you see all the study that we do on optimal fetal positioning, there are a couple of things that is. So it's not just one particular positions. I have seen babies come out from all kinds of positions. So let's put that out first, that there is no one right or wrong way of doing anything. This is also about what is how's the baby, how is the mother, what is going on with them. The second thing so instead of saying what we should do, let's go back and say what might get in the way of this baby coming out. So there is a particular way if the baby is, then we know that the rotation the baby will do and the passage he will take is a fairly optimal path or path of least resistance, and what we call the left occiput or posterior, which basically what does it mean is that the baby's spine is curved slightly to the left of the mother's front, and occiput, which means the back of the baby's head, uh, uh, is in the anterior part, left anterior of the mother. So the baby is facing the mother on the right hand side at the back, which means she will feel her movements more on the right at that time as the baby begins to settle in, and a more roundish feel on the left side. Now that's an optimal position. What might get in the way of that optimal position? Like I said, the pelvis may be out. And there are enough resources available now to help you organize yourself, whether it's something you can do at home or something you need to go to see a body worker with. That's number one. So pelvis alignment. And if it is out of alignment, a chiropractor. The second thing, from the front, from the cervix. So if it's like this, now if any to come down that way. The most common one, which I like to say, it comprises of two parts. A lot of our ancestors, 3 generations, 2 generations, leaning forward would drop the baby in the hammock of the belly. The muscles are softer, so his back will curl up. But leaning back would mean the spine on the mother's spine, which is a more straighter thing. So if you stand yourself against a wall and try and curve your back, it won't curve. Only your head will go down. But if you sit in a hammock, your whole back will become C. So that is, these are some of the things, the posture of the mother. How does she spend most of her day? Now, lots of people sit with their legs crossed. So if the pelvis has 2 legs coming out like this and one is crossed, what happens to the basic pelvis? So this is the pelvis, these are the legs. See this? That could be a misalignment. One of the most common ones that we see in today's time is that we all drive with a seat belt. Now, these are micro movements when we are, especially on city roads, when we are always doing this. This is fixed. The 2 hip parts are fixed. Think of your belt, but this shoulder is not fixed. So we are twisting in our spine all the time. Now, constant twisting may not create pain, but the muscles, the soft tissues, the fascia, everything holds that memory of a certain movement. So stretches, yoga, a chiropractor, a physiotherapist, getting your feet aligned right, looking at those things. Some of us have midline defect, like me. I have a tongue tie, but I also have feet that are, this way. So many things contribute to that balance. And nature has a wide range. So it's not like if your balance is off, that's it. No, you're off it's not a cut-off list of a college program that you didn't make the cut. You'll find that when there is an imbalance here, your body is constantly trying to compensate for it or do something for it. So say if there's a twist and your 2 ligaments are, one is tight, one is not, so there's a twist. You might find when you walk that your left side hurts more than your right side, or you have a pain down the left leg. That's your indicator. It's always telling you, okay, I need your help, look at me, I need your help, I look at me. Now, unfortunately, our narrative around pain has become so it's completely pathology. So, and the approach is, if you have pain, have something and shut down the symptom. Listen to the symptom. It's telling you what to do. So that's why posture, some babies need to make a longer rotation. Some babies need to navigate those obstacles more, and therefore length of labors will change depending on what babies need to do. Second part of that would be if the baby needs a certain positioning and the mother is moving with it, those sensations in her body, whether they are pain, whether they are pressure, whether they are pull, whether they are discomfort, and this feels better. When she follows that, that will ease out the baby's birth. Those labors will be different than mothers who are resisting that. So when we are giving birth from our brains, we are listening to other people. But when we give birth from our
Right.
bodies where it is actually happening, the answers are coming through without our thinking.
Right.
And talk about yourself. Remember, everybody says left, but you kept twisting to the right.
Correct.
That was an interesting thing. And I was thinking, oh my God, she's going to the right, but she should go to the left. And then what did I do? I shut my mouth and said, yes, you know it, you know this, and you twist it, and the baby came. And that's all he needed. So he did need that little bit of your facilitation to navigate that last bit. And it didn't seem to be the optimal left, but actually the right. And so that's the wisdom of that balance. The balance is not that you have to meet a medical textbook. The balance is how do I find myself even keeled? You can take it as a metaphor for mental and physical, but also left and right, front and back, in and out, in any way.
Great. So while we were talking about position of the baby, there was one question around breech babies. So Sanam is asking that why aren't majority of doctors willing to deliver breech babies in India?
So, let's jump into this question because this is a conversation and I enjoy tickling your thinking here. Why do we assume that doctors know everything? They have learned something, right? When I start a childbirth class, I'm always interested to know, okay, what do you do for a living? Or what is your qualification? So somebody will say, I'm a chartered accountant. Somebody will say, I'm a lawyer. I'm an artist. Now that gives me a clear insight of how they receive and process information.
True.
Many people whose thinking education is about numbers will ask you statistics. But many people who are more artistic in nature may want to visualize and like movement. So different people will take in information very differently. Now doctors have a certain way of studying. What do they study for 5 years? Pathology, sickness, disease, managing disease. And then they look at risk evaluation. So many years ago, when we didn't have very sophisticated thing and we had skillful midwives, vaginal births were safer than surgery. Now the number has changed to say that breech vaginal birth was safer than surgery. Now they say breech vaginal birth has more risk than surgery, but it's not in absolute terms. Surgery is more manageable, but breech we don't know. So A, they stopped teaching doctors how to do breech babies. B, they started to say that surgery with the antibiotics, with everything is more safer, relativity. What I don't know is anyways unsafer than what I do know, what I practice, what I can manage. So there is this sense of absolutism that this is better, but doctors are taught that breech need to be surgical because they're not taught how to receive breech babies. But the same is not true if it's a different care provider who has the skill to do it. So we come to a very absolute kind of value here, primarily because we have mostly doctors in India. But that's not true everywhere. In dyes in India know the skill to deliver breech babies. So yeah. So
Okay.
doctors
Can
can
you
do it.
also address the question around breech babies? If till when can breech babies turn and come to an optimal position, or is that actually needed?
Okay, so what I'm going to tell you is something that I do with all my doula clients, and I teach it to everybody I mentor. I have what is called a breech list. Instead of saying, turn the breech baby, I first recognize and respect that the baby is capable of turning down. I respect and acknowledge that nature has designed it to turn head down. So the question is not how to turn the baby down. The question is what's holding the baby up. What does this baby need, or slash take obstacle removed so he can touch. So then I have a list which starts from hard tissues is the pelvis balance. Then number 2 are the soft tissue balance. So, there are exercises on spinningbabies.com which help balance the soft tissues. Then it could be, is the structure of the mother like that, which is a rare thing, but I've had a mom with a septum whose baby did not turn despite best efforts. Then it could be, is it emotional? So there was this wonderful gathering of midwives I had with my mentor, Janet Chawla, and she said that babies stay breech because they try and comfort the mother's heart if the mother is very anxious. Now a lot of womanly stuff is said in metaphors, in gentle ways. There's no like, oh, we have to have him do this. Mothering is different than maybe, the disciplinary part of whatever parenting may be. Mother saying, koi baat nahi beta, coaxing the baby along. So is the mother really distressed? But another way to look at it is if the mother is distressed, then the beat of her heart might be the most soothing sound for the baby and is keeping the baby's head up. Can she let go? If she has a certain amount of anxiety, other than emotional, physically, her muscles will be a little bit tighter. We all feel a little tight when we are very anxious, especially chronically. Does that help? So that might give baby a more, space of flexibility to be able to turn. A rigid container versus one that he can manipulate. So that could be one of the things. So we would maybe use hypnosis for it. We would do art visualizations for it. We can use many mediums to get insight while we are tuning into the baby and asking the baby, what do you need to turn? We are also opening up a possibility to understand that this is the baby's choice. It's his journey, if I may say that. And so majority of babies will turn. So there was an Israeli study on hypnosis, and they said that the control group, 26% babies turned anyways around due date at the time of labor. But in the hypnosis group, 81% changed because they did release some fears, anxiety, tuned in with the baby. And that's a very big variation. So it could be that, sometimes the baby may have an insight that we don't know. Ultimately, we have to settle down to say, how do we parent? How am I the mother or the father or the parent of this baby? Is to ask the baby what they need, respect their individuality. We are hearing a lot about individuality, consent, autonomy. It begins right from the beginning. This is your story. How may I help you? How may I support you? How may I guide you? It's a privilege. So the last step is acceptance. And you'll find a lot of babies will change with just physical change. And a whole bunch will also change when the mother kind of either lets go of her fear or at least names it, faces it, and owns it. Sometimes the fear, unknown quality of the fear, the trying to hide it down is, how when you want to hold something down, I will not let it come up. That's the rigidity. But you say, okay, this is what it is. And then suddenly you can be saying, okay, that's all I can do. I think there's a lot of pressure on moms as well. So these are my steps: hard tissues, soft tissues, mental, emotional, spiritual. Spiritual being saying you are in charge of your process and I accept you. So that's the list. If you go down that list, you'll find a lot of, I cut down a lot of working with breech babies by just going through this process with my families that I worked with.
Sure. So there was one question around posture, exercise, and movement. Nitya is also asking us that in case of a breech baby, will these posture and movement during birth help for an easy vaginal birth? Will these movements help the baby come out like other babies?
Okay, so firstly, come out like other babies means what? There's a vaginal passage, so yes. What are the postures that I'm saying? So you are going to take, if you look at the anatomy of the pelvis, how a person is, and how the female pelvis is not here but rotated. If you stand and give a nice curve to your lumbar, the front part, the pubis symphysis, or the front joint of your pelvis tilts down. It actually comes in line with your tailbone. It's not like this, it's like this. If I can just grab very quickly, a small pelvis. See this? This is not your pelvis. This is. And then you will get that curve at the back. If you are like this all the time, the key factor here is that your pelvic floor, which is here, will then get twisted upwards. So we want to bring that pelvic floor absolutely parallel to the earth, so that the baby's journey is downward and not upward.
Upwards.
So posture will help definitely, no matter what you do. Not only help with the baby, will also help with your well-being, the backache, because your vertebrae aren't designed to compress on each other like this, bulge out like this. They're designed to be this way and then go up into the thoracic. So posture will help. Movement will always help. We can't move the baby, but we can move the mother in relation to the baby. We can't move the baby through the pelvis, but we can move the mother. But will these movements help if they are organic to you? Yes. Now, why do we go to a class? Why do we practice this? Because to do these movements, we need a certain amount of muscular understanding, or, mind-muscle connect. If you've never used a muscle in your entire life, and in a moment of birth, we tell you, okay, now you do a squat, you're not able to do it that well. So the practice is to keep every part of your body ready for what might come up, but then drop it. The duck walks will get the normal baby, the squatting will get the normal baby. Just drop that and follow what your body says. So practicing movement, practicing posture, practicing is also a way of getting in touch with your body. If this feels uncomfortable, how does this feel? Who's going to tell you that? There's no expert. You're the expert on your body. So the movement, the posture, the movement, and the exercise, these are all very important to be done, because this is also how our body stays healthy. We are in touch with our body. We tune into our body, and then we take that, but it's also like a permission to move in labor, because a large part of people think natural birth, but in their head, in their subconscious mind, there's a picture of them lying down on a bed. And that's the disparity. So, yes. So I know Neha's saying dance too. Yeah, movement is dance. So in fact, dance is one of the best ways to move. So thank you for that, Neha. Yeah.
So another question which has come is, what is the best a mother can do to bring the baby's head into a position for vaginal delivery? So you have covered, I think, a
I think I've
lot of
answered
it.
it, but
Yes.
also talk to the baby. Tell me, when the baby is born and really tiny, what can a mother do to get the baby to eat, or listen to her, or sleep, as a toddler? What is to talk with great respect and listen what the baby is saying, not just tell them what to do. So parenting advice, even when they're in utero, to say, sweetheart, and it's not like you have to teach them how to go down, because that's a default setting again. It's pre-programmed in the DNA that at this time, and it's done physiologically, because there's a physical
So
substance to it
Divya,
as the
while we
brain
are on this,
grows.
can you also explain the cardinal movements of the baby?
Oh yeah. Oh yeah. So yeah, the baby's doing a complex dance, right? And it's called cardinal movements. It sounds very good. But basically, I said the babies go down looking towards the mother's right back. And that might be an easy way. So if you see this really thick part of the sacrum, these are the guidelines which tells the baby, okay, this may be an easier way to go down. And as they lower and come into the narrow part, they would tuck their head in, and that will be facilitated by this hammocky muscle and the firmness, not rigidity, but firm flexibility of the pelvic floor, which help them tuck their head in, and then they would rotate, because the shape of the pelvic floor is like this, so they might fall in and rotate like that, and then move through. And as they're coming out from under this little arch, the head is rotated in, and now they only extend it out and then come down the birth canal, and the head is coming out. So the head comes out looking down, And then while the shoulders are inside, the head is outside, they rotate again to bring their shoulders in line with this narrow part. And then bring their shoulders from under this and push themselves out. Babies are really working hard to be born, and which is why we call it labor. Hard work.
Absolutely. That's a lot of work. Okay, Lakshmi is asking, will a breech baby turn head down post 32 weeks after the baby
Yes.
becomes big?
Yes. Big for what? Yes. They can turn down till the last minute.
Okay. Thani Ganesh is asking, during 36 week scan, will we be able to find out the baby's position?
So baby's position doesn't need to be found out with a scan. The doctors can touch and feel and palpate and tell you. But also I would not say, and even medical textbook will not call it breech up till the 36, 37 weeks. It's, the baby is supposed to be free in his movement or her movement throughout pregnancy. By naming it as breech and putting it at 32 weeks, we are setting the mother up for anxiety. Look at our questions, Tanvi. They know that breech is a C-section. They know they can't control it. So it's like a little bit of a setup. Why are we naming it breech? We should call it breech only at the appropriate time.
Time. Yes.
So since anxiety is so deeply rooted with what the baby can or cannot do in the mother's body, her hormones, her tissues, baby's well-being, sense of well-being, we're setting them up. So let's give it the right name. That the baby is not head down yet, but it's no breech. And you can say that this is just semantics, it's just words, but words are powerful. Simplest thing, if you say, don't think about labor and birth, just think the word contraction. How would you represent it? And I bet you 99% people are doing this or this.
Yeah.
And what do you want to do in labor? This, not this. So words are powerful, and we must be very careful of what we say, because the representational mind might see it differently.
Like how you ask
Last time
everyone in our childbirth class that what comes to your mind as soon as you
when
hear
I
the
say
word
the word,
labor.
and how quickly they make that association. And remember, last time we did that fear was, maybe it was before last, that fear is natural and we have a negative bias. So the word breach on that report is a setup, maybe unknowingly, but it is true. And once you've heard it, there's no going back from it. So
Right.
that's the catch. We are safeguarding this mother's journey, just like she is safeguarding the baby's passage. And all of that is happening.
Right.
Yeah.
So, Thani, I'm going to come back to your second question in a bit because that's related to episiotomy and perineal massage. I'll take up a question from Manisha, and she's saying that can you please suggest a few books to prepare for natural birth, what to take care of even before conceiving?
Okay. Very easy question. Short answer. You want to give your baby the best of yourself. And the best of yourself should be good enough for you, and it'll be good enough for your baby. So that starts physically. Good food, good lifestyle, exercise, healthy tissues. The reason I'm saying this even before you conceive is because every input into your body, your experience of the world, is like a new code for your genetic makeup on the epigenetic part. The food you eat, the lifestyle you have, the emotions you're saying, everything in the body ultimately boils down to some kind of chemistry. And that chemistry is being read by those germ cells that are going to make the egg and the sperm, that says, okay, that's the world, let's gear up for that. Or that's the world, that's the chemical change it's making in me. And that's called epigenetics. That's really simplifying it. So if you start to pay attention. Now, I want to really bring in this idea that when you're paying attention, you're not just paying attention to food. You're also making an intention to welcome a baby. You're making a change with a purpose, and that purpose is a human being. So you're bringing that quality in as well, which becomes conscious conception then. So you are working around that. So 3 months before, even more. I mean, just saying 3 months, because the body metabolizes your experience over time. But it could be even more. So if say you do have a lifestyle which has alcohol or nicotine, then letting that go, cleansing it, detoxifying, not just physically, emotionally, bringing your body the way it should be, bringing your best as an offering to this person you're inviting in your life. And then accepting your best. Because you're also telling this person that I'm not looking for perfection. I am bringing myself with love, so come to me with love. And I think that's the way to start with, and throughout pregnancy the same. But the book that you want to, I would highly recommend, is Aina May's Guide to Childbirth. It's a very good balance of science, spirituality, and reality. And it puts you center. So it tells you what the potential you have, but then it's up to you how you want to take it through. So yeah.
Great, thank you. Nitya is asking, as we know that labor time is sometimes very long, can mums lie down whenever she feels like? Or is it like she needs to keep her posture upright at most of the time?
Okay. She can lie down if she wants to. Nobody can keep their posture upright all the time. Again, going back to her body. If she is getting too tired, how do you think the labor will go on? The body will protect itself, slow down labor. So it's good. She could see which side she prefers. Ideally, they would say left lateral, which means lie on your left side. But again, how does that feel for you? And lifting your leg up might open up the pelvis a little bit. What support would you need for that? So yes, you definitely can lie down. If you can't lie down, so one of the tips that I teach in my childbirth class, which I feel takes you through labor beautifully, is no matter what position you take, if your head can rest, this is, I have never heard anybody else say it, but I say it all the time. If your head can rest, you can rest. Which means when your hormones take over and you're in labor and really you're not doing much voluntarily, that's the time in that semi-hypnotic state that you just want to put your head down and let time drop. Drop means no more, time will not matter. So if you can rest your head in between contractions, while you're sitting, while you're standing, while you're lying down, however your position is comfortable, you can get it. You will get it.
Great. Nikita is asking, I've heard doctors say roomy pelvis. Is there anything called a roomy pelvis?
Yeah. For them, yes, since they are saying it, so they are doing some measurements. The measurements could be this, and diagonally. And there are certain values that they have learned. So roomy pelvis, if the dimensions are already matching that, that's their roomy pelvis. What they don't know is because they have women give birth like that, pushing the baby here. But if this joint can open, say, let me just show it to you, this much, then your non-roomy pelvis will then open and expand into a roomy one during labor. And therefore movement, posture, all of that will matter. So
Okay.
they are looking at static dimensions. We are looking at bio, and I use this word very purposefully because there's life involved, biodynamic. You're moving through your body. Your biology is informing you what to do. Biodynamic movement. This bone can move. This dimension can change if this bone moves away. This dimension can change when this joint opens, and this dimension can change when these joints move. So yeah, statically they are measurement, but dynamically it's movement, posture, and that internal guidance. Yeah.
Sure.
Does that answer the
Yes,
question, Tanvi?
yes. I hope it does, Nikita. Brishti is asking that I'm in my 38th week. And should I exercise to induce labor, or should I just wait for my pains to start on its own?
What's the rush? That's my first question. Is there a medical reason to rush the baby out? No. If not, if yes, then follow what the doctor says. Understand the medical reason and follow what the doctor says. If there is no rush, then what does 38, I mean, I'm more interested to know what that number 38 weeks means to this person to generate this question. Is there something that is associated with that number? If no, if that is also not true, and it's just like everybody says, by 38 weeks, then I'd say give the baby all the chance to get ready. And I think we did this talk once about transitions and how they're still getting ready. Even only when the baby is ready will the baby initiate labor. And from the mother's part, she's keeping the field wide open to say, I receive what you're giving me. That means removing all forms of anxiety, however best she can manage.
Right. So, Vrishti, you can also, go through our IGTV to view that,
Yeah,
topic.
she's actually written the reason her liver function tests are high.
LFT is high, yes.
Yeah, so now there is a reason why she might want to expedite, and we will respect that, right? So what can she do to control, keep the levels low? What kind of diet change she can do? So they might, kind of change her diet a little bit, and then observe it a little bit more. And then you could do acupressure. You could. So I again have a policy, personal policy, to suggest least invasive to most. For me, ingesting something that cannot be undone is most invasive. So you can start with, say, a massage. You can do, a fear release. You can also use hypnosis if you know somebody to set your body balances right. You can inquire within. You can tell your body, thank you for supporting me and my baby. What do you need? Why is this liver function high? Nothing is happening without a reason. But even if we don't receive an answer, and a conscious intention in that place is a very good idea. You can do acupressure. If you believe in any kind of alternate treatment, whether it's Ayurveda, Bach flower, homeopathy, what you believe in will help you, because your belief is the substratum on which they'll work. So no matter how much oxytoxic favoring substances you have, if there's high degree of anxiety, it'll be suppressed. And then also the spiritual aspect of tuning into the baby and surrendering to what is going on. So yes, in this case, you could do something to support your body to get ready for labor. Whether it will induce or not is not something anybody can guarantee. Even with an induction, whether it will function or it will be successful to a vaginal birth, nobody can answer that. But yes, you can take the steps and take it from a place of facilitating the baby's coming, acceptance of the situation rather than desperation, because desperation itself is the block.
Right.
Oh, wonderful. Thanks. My pleasure.
Thank you, Vrishti. Another question from Kanojia Kiran. She's asking, are there any specific exercise one needs to follow from first trimester? I heard last month to do squats, breathing, walking exercises, but not heard from initial month. So basically, she's asking that in her first trimester, can she start doing some exercises and breathing and walking?
Okay, so again, I'm going to offer this back to you so that you can make a decision. What do you mean by exercise? Every one of us have a typical routine. Some of us go to the gym, some of us do yoga, some of us go for a walk, some of us don't do anything at all. So what we routinely do is a normal part of our routine, and we can continue that through our pregnancy, because pregnancy is not something that has affected us. It is a normal adaptation of the body. So the body does know what your resources are, how you use, how your muscle strength is. Everything is progressive. It's not 1 minute you're here and then you jump and become here. So that's the number one part. Then you've got to say, when you're doing a certain kind of exercise, as the pregnancy increases, how does it affect balance? Because as the baby grows, your center of gravity changes, and so your balance goes out a little bit. So high intensity or sports that need running may not be possible, but swimming may be possible because there's a balancing. Thirdly, in the last trimester, well, you are looking at the different parts that might support your labor and birth. So thighs, opening up the pelvis, exercises that do that, like Titali Asana or squat, those kind of things. But they're more like a gradation up than now do this, now do this, now do this. So if you start to squat in your 9 month, but you've never exercised before, how's that going to turn out for you? So if you know the principle of what the squat is going to do is open up your pelvis, then can you find a easier or a simpler way to do it till you build the muscles that will sustain the squat? So a supported squat or a kneeling position, different things. In which case your exercise regime is co-decided, co-created between an exercise person and you. It can be entirely you as well if you're already somebody who's knowledgeable. But if you're going to start from zero, then you get somebody who understands and works it with you, sees your limits, knows how much to push, and always keep tuning back saying, does they feel good? Also, when you're exercising, make sure, so you can't start a high intensity exercise with very poor lung capacity. So you are trying to balance it out. So much as I like all the information there is, and we have that too, but it's also to be taken in and used that works for you. So yes, you can exercise throughout. The level and intensity should be co-decided between you and whoever is guiding you. And if you are already a pro at exercising or not, the ultimate is how do you feel? Because if you are not feeling okay and comfortable, then your body is telling you to stop. Follow that.
Okay. Rajesh Shekharan, Deepika is asking, baby is in cephalic position in 30th week. Can you please explain about it?
Well, then your baby is a big planner, I must say. So why is the baby coming down? So as the baby grows, this part gets heavy, he's floating in water. Physics, head down. Some babies can move still, but prefer to come down. Some babies, I like it like this. Maybe I'll go down when it's time. So if the baby is down at 30 weeks, not a big deal. It's just the baby is ready to and comfortable to be in that position now. But ultimately, all of them will turn their head down if nothing opposes that natural movement.
Right. So Rajansi is sharing her experience. She's saying, "Ma'am, I delivered my baby while I was in my 38th week. They said that my baby's heart rate was too high and had passed meconium and found some stains. They told her that it was not safe to induce labor, so have to go for C-sec. How do we know if the baby is ready to come out? I didn't have much pain, and the pain was very mild and very mild contractions."
No, so she said that the baby's heart rate was too high. So there's a process of finding it out. One reading of heart rate is not good enough. I'd also like to know what is going on around with her. So if the mother's heart rate is high, the baby's heart rate is high. Was the baby's heart rate high during a movement or was it high all along? So there are many unasked questions here which we'd like to listen to. And I think it'd do her well if she also sits with them. Then they said the baby had passed meconium. How did they find that out? Because it can't be found out in any other way other than the water bag releasing and seeing the green color. So that's a very clear indicator that there was out. Again, what was the color, thickness of that? Where was she in her labor? So there are a lot of things, unanswered questions. So, if I generalize it and say right and wrong, that might be a disservice, not just to her, but to everybody else. But I'm happy if she writes her birth story to us. I'm happy to sit with her and kind of lead her through it and encourage her to seek these answers. Whether they are appropriate or not, only time will tell, because we don't know what they did and why they did it. But if she knows how to get the answers, you might find it's easier to integrate the process. And I think
Yeah.
that's more helpful than the right and the wrong of it, because the right and
Yeah,
the
it'll
wrong
be
only
great if
creates.
Preeti, you can just write to us. I'll message you our email ID
No,
separately, and it'll be great if she can just
no, she's writing.
yes,
They
sir.
saw in the scan. The scan doesn't tell you meconium.
Yeah.
The scan doesn't tell you meconium. You have to see it.
So she can share
But
her
I'm
story with us
still
separately.
happy to talk to her about her birth and
Yeah,
what was going on before to help her integrate it. That goes without saying, whether, whatever there is.
yeah. One question which has come from Kanikara. This is the second last question we'll take. Does reduced fluid
You have part
6.8?
one question about
One
episiotomy.
question, yes. So that's why I said second last question. I'm going to go back to that question. Does reduced fluid level, which is 6.8 in 37th week, lead to any complications? And how can I increase my fluid if the baby is encephalic and head is not engaged yet?
So baby's encephalic head is not engaged is just the baby's way of showing that I know I need to be born and I've already turned down. That has really no major bearing on everything else. Now, when you say 6.7, what is the range that is put? There would be like a range. I'm in a different session, but let me go through it again. The typical case of amniotic fluid index being on the lower side, that says that the water is this much today over an estimate which they have done. Now, there are a couple of things that you can do is to hydrate yourself for 72 hours, including using a really good electrolyte, which is nariyal pani. If it was just merely dehydration on its part, and it is possible with the weather like being in an AC, but it's dehydrating. How much fluid intake do we have, and how much is our salt balance? Because sometimes when we take in a lot of fluid, the salt gets a little bit off balance, and that's not okay either. So having a good electrolyte and then repeating the test to say, so three possibilities may happen. First one would be that the amniotic fluid index is now increased, and this is the end of the story. Yes, it was dehydration. Let's move on and make sure that you're well hydrated. Number two is that even after 3 days, it's still the same index. You've not had, but it's still steady. Let's wait and watch. Again, nothing really needs to be done. We're waiting and watch. It's still within the range. The third is that despite your best effort, if it is fallen, that might come in the category that this needs a discussion with your care provider. So the first step is hydrate, then find out what has changed. And also sometimes doing the test in a different place might help. The position of the baby may help because they're looking for pockets that don't have baby parts in it. So that may help. These are things that are not like fixed. It's not a line in stone. It's more like a line in the sand. And so waiting, hydrating, doing your best, and then reevaluating will always be the best course of action, because it'll give you time to integrate, take control, and have a discussion about what is happening, but also not seeing what it is today, but how it's progressing. So how we can see the future, or how it might be leading up to, as time progresses. That's a very important factor here.
Right.
Does that answer your
Okay.
question? Okay.
I hope it does. I'm going back to the last question, which I had parked initially. Thani Guy Ganesh had asked regarding perineal massage and episiotomy. Does massage helps in avoiding episiotomy?
Avoiding, again, putting a lot of controls. Avoid episiotomy. Now everything is tight, holding the barrier. Let's let that go for a minute. The choice is between, would you want somebody to cut you, or are you okay if it tears? That's the bigger question to answer, right? A perineal massage is giving the area there an idea, or you an insight of what that perineum feels like. And as you're massaging it, it tells the tissues how to spread. It might also give you an insight that when I touch it, how I tighten up, and what might do to relax it. And that's one part of that perineal massage. You might use an oil, or you might use EPO, which is evening primrose oil, which might have substances which are precursor to prostaglandin, and prostaglandin makes tissues softer. But then so does warm water. So while you're giving birth, you can put a hot compress there or a warm compress there, and that can soften it as well. So the whole idea is to become aware of where your perineum is. How does it feel when it is touched? What might help you to release it? That's number one. Number two is, what is the dynamics of baby's head versus the mother's perineum? And that could be, the hand could be here, and that's a little bit extra space. Thirdly, if this is the perineum and this is the baby's head, let's just get the baby's head here, right? Now, if you are lying down and pushing upwards, see what happens? I'm just going to give you a visual. Versus if you were upside down and you were pushing with your body and then relaxing, nothing. But the head, the weight of the head is still there on the perineum, and it's still gently pushing that tissue away. And then again, and relax. And of course, all of this is lubricated by vaginal fluid and everything else. This is pretty dry, so this is not a representation, but an idea that letting the baby's head gradually spread the perineum versus pushing hard against something that is already tight, because when you're doing, it's getting tight down there. So which would need more help to spread? If you're lying down, pushing hard, holding your breath, tightening your jaw, then you are, the dynamics of the perineum will change. When you're talking about episiotomies, when you're talking about perineal massage, you have to look at the whole process. If your idea is to avoid an episiotomy, then you also are talking to your doctor about giving birth in a position of your choice, not aggressively pushing, but following your body's lead, finding support from outside that helps you pace it out, finding feeling in your own body, what does it feel to have something there, which is coming from inside out, or having a sense of how your body tightens and what might help relax it. And then of course using a warm compress, or maybe if you're comfortable, even your midwife's, your doctor's hand, whatever you're comfortable in, because if it's done to you, you're only going to clench against it, and that's counterproductive. So the whole exercise of perineal massage is about getting in relation with your perineum as a part of you, in your control, not controlling the outcome of an episiotomy, tear, stitch, etc., whatever that narrative is. That just gets too much for me at times. And I hope that helps you think this through.
Yeah, hope so. Just one last question. Neha had asked, can you please talk a little about the signs that can tell that there may be an imbalance and would need an extra attention?
In what? The body? We talked about amniotic fluid and we talked about this. So since it's posture movement and balance.
Posture movements, yes. Yes.
So firstly, the gait. How do your left and right move in your own body? Do you prefer one side or to the other? One of the better exercises to do is to do a hip circle. How does left and right feel? Or a figure of 8, belly dancing. How does that feel? Or when you get out of bed, does left feel different than the right? So evaluating left and right, standing this way versus standing this way, again, inside, outside, left, right, front, back. Evaluating that sense, which is more at ease, will tell you an imbalance. But if you're okay on both sides, that's a balanced body. When you walk, do you prefer one leg? Do you need to hold one side? Is there a pain down one leg or the other, or the back, one hip joint, other hip joint? So having a sense of your own body is telling you to come into balance. In fact, every ache and pain in our body is our body's cry for help. I have been compensating for this for so long. Now it's my boundary, help me. So take that as an indicator. Don't take the pain away. So don't take a painkiller if you're feeling pain in a leg. Be curious about it. Of course, support yourself, definitely. But say, why does it come on my left side all the time? And you'll find maybe a little bit of an adjustment of posture, straightening, or a little bit of a massage, or even physiotherapy, whatever it needs, that might sort it out. The cause, don't shut down the symptom. Deal with the symptom later, but hold curiosity maybe for a moment. That's balance.
Thank you. Divya, would you also like to just, since we're done with most of the questions, just talk a little bit about, the online class that we're going to do?
Yeah, we are. So So we find that everybody's going online. So are we. And we also find that time, sitting in front of that and scheduling times in front of screens are becoming very hard. So we brought in a mixture of an interaction like this and some study material, some things that you can learn on our online platform. So we have an online platform